Dr. Nerissa Bauer, behavioral pediatrician and CEO of Let's Talk Kids Health. I absolutely love bringing people together so that we can all talk about kids' health topics. As you know, October is ADHD Awareness Month, so I have assembled the best, the brightest, and a rock star panel of folks today to help share their knowledge, their expertise, and maybe even their personal experience, because I think some of us have ADHD. So I want you all, and I'm inviting you all, this is going to be interactive. So if you can, please make sure you authorize StreamYard to see your profile, because every time you comment or add a question and use hashtag ADHD, you will be entered into a very special drawing that will be happening at the end of this broadcast. I love to give away stuff. I'm kind of like, Oprah and Ellen that way. So anyway, so I am so excited to have assembled a powerhouse panel of guests tonight to help us talk about tips for supporting children and teens with ADHD. So remember, tonight as you're coming on, make sure you use that hashtag ADHD so we know you're there. I can see some of you watching. Don't be shy. Say hello. And so without further ado, I am going to start introducing really quickly my guests. And then you will be able in the coming days to see a little bit more about who they are, just because I want to make sure that we spend enough time reserved for the chat. Okay, so I am going to start in no particular order with Dr. Diana Mercado. She's a family medicine physician who works at a clinic, hospital, nursing home, happily married, and has a 3-year-old daughter and a 4-year-old son, and founder of Overachieve Life Coaching, company designed to help physicians and medical students create systems that are so simple that even someone with ADHD can implement to support their own zone of genius. She enjoys travel, painting, Zumba, yoga nidra, meditation, and exploring different cultures. So thank you, Diana, for coming again to the show. Next, I have Lisa Navarra. She is just an amazing person. She's a behavior specialist, special educator, and published author of children's books, music, and teacher resources. She provides professional development, including social emotional learning and executive functioning training, so students with exceptional needs can learn and teachers can teach. And so I am so excited to have her here, but I'm sure she's going to be sharing with you some of what she does during this conversation. Thank you for joining us again, Lisa.
Thank you.
I have Dr. Julia Schechter. She is a licensed clinical psychologist and assistant professor in the Department of Psychiatry and Behavioral Sciences at Duke University School of Medicine. Dr. Schechter is a faculty member in the Duke ADHD program, where she participates in research, supervises clinical trainees, and provides clinical services. In her clinical practice, Dr. Schechter specializes in the empirically supported assessment and treatment of developmental, psychiatric, and behavioral disorders, especially ADHD. And she is co-director of the Duke Center for Duke Center for Girls and Women with ADHD, which launched exactly a year ago.
It did, yes.
Yes. Thank you for coming back to the show. Dr. Lola Day, oh my gosh, she is a multi-passionate, busy mom to 3, double boarded physician, an ADHD-trained life coach, productivity and mom life strategist, and creator of the Lola Planner. And she's also a podcaster. My gosh, look at that. She has 3 self-produced podcasts. Amazing. And in addition to managing her own ADHD like a boss, she is also the CEO and founder of Lollytasking, a coaching and consulting firm for easily distracted professional women, where she teaches these amazing high-achieving women how to live a fulfilled, wholesome life by focusing on what matters so they can accomplish their goals with ease without their brain sabotaging their efforts. Thank you, Dr. Lola Day, for joining us, even though you are still at work. I appreciate you so much. Zach Grisham, he is not a stranger to this broadcast. He has come on my show and been a guest, so I'm so excited to welcome him back again. So Zach is an LPCS and certified ADHD professional who counsels many children, adults, and families dealing with the diverse effects of ADHD. He was first diagnosed with ADHD at the age of 15 and has a unique perspective in helping those with ADHD understand those with ADHD. And he is the owner of Clearview Counseling Group in Dallas, Texas, and author of a wonderful book that I recommend all the time. And hopefully he'll be sharing some of those strategies today. Lafayette Mitchell. I mean, girl, I cannot even tell you. So she is a licensed marriage and family therapist. She has worked successfully with families of children, teens, adults with moderate to severe social, emotional, and behavioral issues for over 20 years. Her experience and success led her to create the Lafayette Way, an advanced relational philosophy lighting the pathway to peaceful relationships with hypersensitive people. Thank you, Lafayette, for, as always, being here tonight. And then lastly is Dr. Ujjwal Ramtekar. He is a good friend who I've gotten the pleasure of meeting through work that we've been doing together with the American Academy of Pediatrics. Innovative healthcare administrator, psychiatrist, and telehealth expert with passion for creating patient-centered solutions to improve population health and business outcomes. He draws upon clinical and business expertise to engage stakeholders and execute large-scale change initiatives through technology-enabled healthcare delivery models with system-wide impact. He has demonstrated success launching and scaling quality improvement and telehealth initiatives for leading healthcare organizations. So my golly, I am so excited to have all of you here today. This is an amazing panel. So without further ado, as you guys have some questions, please start putting those in the comments and saying hello. Use hashtag ADHD. And I'm going to start asking my panel some questions here so that way we can get started talking about tips for supporting kids and teens with ADHD. Okay, so let me ask the first one without further ado. I would like to start with, what is the biggest challenge that you see when it comes to ADHD? And it could be from the lens of for parents, for kids, or families. So I'm going to go ahead and maybe call on Lisa, since you're like next to me, if that's okay.
Absolutely.
Okay, let's do it.
I think one of the most areas in which children with ADHD face is being understood, really being understood in terms of what they need to be able to reach their potential. I think it's very common for people to say, oh, I think I have a little ADHD today, or oh, I'm distracted. Mm-hmm. And so because it's become so mainstream, we really, generally speaking, haven't really dived into what it is, how it affects children, and sincerely what they need to be able to succeed in school, and then how can we support that process at home. So I think that's a very big missing piece. How do we teach toward their executive functioning skills so they can self-regulate? I think that's a big part because of that misunderstanding.
Wow. If you agree, please put comments in the chat. Anybody have anything to add to that before I pass it on? Because I'm so glad that you brought that up, Lisa. Anybody else want to comment on that from that perspective? I'm just so excited that you are leading the way and recognizing that this is such an important thing. I think with COVID, it really amplified the fact and brought to attention how differently kids with ADHD need instruction, but also how we have to pay attention and meet kids where they are. So again, I just love the work that you're doing. So thank you so much for being here.
My pleasure.
Julia, Dr. Schechter, what do you think?
So I think there are a lot of challenges. I think from my work at as a co-director at the Duke Center for Girls and Women with ADHD, one of the challenges I hear a lot about is just identification of ADHD, especially in girls. Oftentimes, girls with ADHD are just harder to identify, and this is for a variety of reasons. One is this pervasive misunderstanding that girls cannot have ADHD. It's just a boy condition, and we know that really is not true. Girls also tend to have more of the inattentive presentation, and so that just makes it harder to identify. And we know that the girls often go misdiagnosed and mislabeled for many years before their proper diagnosis is given. And so I think just that is really hard for girls and their families. And we certainly want to make sure that we get the message out that girls can have ADHD, just can look different than boys.
Mm-hmm. Yes. How many of you agree with that? Yes.
Oh, yeah.
Anybody want to add to that before we go on? Because I feel like that is such a huge issue. Folks who have been following me, you know that I was just diagnosed this year, formally, and I just turned 48 on Sunday. I kind of knew, but I kind of also like it just, when I finally got that diagnosis, it sort of made sense. I was like, oh my gosh, that was the last puzzle piece missing, right? But so many families have been wondering about ADHD in girls, women, and especially the coexisting, like with autism or other, like anxiety too. So that can be really tricky to diagnose. So I guess my question to you, Dr. Schechter, and anybody else on this panel, if you have a child or girl who you are concerned about, what would you recommend?
Yeah, it's a great question. I think I think the first step is just education, right? The first is just knowing that this could be a possibility for your daughter and doing some research about that. We have some information on our website, but certainly there's some other great information, lots of great information out there. But just first educating yourself on kind of what could this be, and then advocating. I think there are a lot of providers out there, really well-meaning providers, that don't know that this constellation of diagnoses can be present in girls. And so being able to kind of go to those providers and say, I think this is something that I really want to explore. Can you help me do that? And then kind of being able to sort of, potentially even, push back a little bit if they say, no, this can't be the case. So being able to really, to advocate for your daughter and getting that evaluation.
Mm-hmm. Yes. Okay. Anybody else want to add anything on that idea? Yes, Zach.
Well, just that, I'm seeing an uptick in more reporting of young women that we're seeing in our practice here. But I think the environment is hopefully shifting a little bit and understanding that it's not just, boys that are bouncing off the walls, it's much more diverse.
Mm-hmm. Certainly.
Usually females are going to get diagnosed once their systems don't continue to support what they've been doing. So whenever they get to college, or whenever they might get, the job promotion that now they're doing a lot of more admin work, or when they get to law school, or when they have the birth of their first child, or even once they hit menopause, or, so it could be in stages, or it could be as soon as their kid got diagnosed, they're like, oh, I'm doing the questionnaire here, and I check all these boxes, right? And so I think that one of the reasons why females don't get diagnosed earlier per se, yes, the inattentive type. So you're not really causing a ruckus. You're in the back of the room daydreaming and you're not causing a ruckus, right? But if you are lucky enough to be aligned in something that you enjoy doing, you're going to outwork whoever is around you, because you think that this is the price that you're going to quote unquote pay, or this is worth it, or this is just what it means for me to be able to do X, Y, and Z. And so I think those are contributing factors. And then, of course, if you look around and all your family's acting like you don't think that this is abnormal, right? Because not that I'm saying that ADHD is abnormal, but you know what I mean? Like, everybody is doing what you're doing. So this is just the way my family is. And you don't realize that, oh, maybe my whole family has ADHD, right?
Very good point. Very good point. All right. So, Zach, I'm going to throw that question to you. So let me repeat it. What is the biggest challenge that you see when it comes to ADHD?
I think that understanding it from a whole systems perspective within the family is something I think goes kind of unnoticed, and understanding that, especially if you have, let's say, a more neurotypical parent and then a child with ADHD, how does that affect their relationship and the dynamics between the two of them? And then how do certain parenting styles affect, the self-esteem of the child, their own perceptions of themselves in the world? And so it's really about creating a system and environment within families, but also not families, just school as well, that can at least account for ADHD. I get so many parents in here that once I give them information, then they're criticizing themselves. They're beating themselves up over it. And, they themselves very likely, like we just said, may have ADHD, or at least some behavioral aspects similar to that. And so it's really about critiquing themselves and not criticizing themselves, and trying to work on, minimizing certain behaviors so that they can hopefully instill, certain thoughts and values in the child that, can support them and not lead into some of these really negative thought patterns that we see oftentimes in our sessions. That I'm out of control, or that, the world's against me, and things like that.
Yes, thanks for bringing that up. I think it's really, those of us who work in pediatrics, but also, I mean, that for sure, we see that a lot. But the negative thought patterns is so big with individuals and kids, women, with ADHD. And again, I'm sorry, I'm just making sure that I'm checking comments here. But anybody else have something to add to that?
Oh yeah, I just wanted to add that this thing that I call, relationship related PTSD. So when we're talking about the families that they all misunderstand one another, some neurotypical, some not, some think they're typical and they're not, all of that, you run into the families that are just war torn, right?
Yeah.
They're set to be upset, and that can really, create a lot of blockage, inability to promote the change within the family.
Mm-hmm.
And one of the things that I often say is that just having a child with ADHD almost wires you to have anxiety because of the activity level of the child, or the consistent redirection, or even if it's the inattentive child. I just had a session with a son and a father, and just I could see the almost anxiety level rising with the dad, just consistently trying to redirect, get him to stay on focus. And that's one of the things that we have to attend to as mental health providers, is not just the child, but the environment.
And then if you consider if the parents are divorced and it's not an amicable divorce, on top of just being divorced alone, which could be traumatic for young children, as we know. So that's something else to really be sensitive toward, I believe.
Mm-hmm.
And I think one more challenge that I want to point out is that we're talking about not being able to focus. And that's almost like a misnomer, because you can't focus on certain things that you find boring, right? And so things that you kind of find interesting, again, you might hyper focus and you might be there totally engulfed, lose track of time, that time blindness aspect of it. And then people are like, well, I don't understand. How come you can do that and you can't do that? And it's almost becomes like a shaming thing, right? And you're like, well, I do like this other part. I'm sorry, I don't like that part, right? And so, again, not knowing what you don't know, and the kid might be trying their best to meet your expectations, but they literally don't have the tools to be able to do that. And they come so short of it, and they never feel like they meet your expectations, and therefore their self-esteem just suffers. So the point of focusing and hyper focusing, and again, it's, if you don't know, you don't know, right? But that is something that you also need to understand, that your intelligence level and is never going to be affected by meds or no meds. You're always going to be this bright, amazing person. It's just that your energy might be scattered in all the passionate things that you're having coming into your life. And so again, learning those tools and techniques and realizing that you have to just learn how to get it to focus just right, not over, not too much, just right.
And I believe that's such a great, solid point, because I believe where that not only begins at home, but also in school. And to be able to teach educators that sometimes an extrinsic motivator is okay, because you're actually explicitly teaching those skills that you're talking about right now to become independent. But sometimes, because we don't always have that teaching and that behavior background, individuals aren't aware of that. They're not even sure how to teach these skills of positive self-talk or perception, or what working memory is explicitly to children in the classroom. So what you're seeing is the aftermath of what we could have started right in preschool and in kindergarten, once we start seeing some of those behaviors. And those are the reasons why.
I'm with Zach. As a mom who has ADHD and a daughter who has ADHD, you see that way, way early in the relationship aspect. I have a lot of moms in my coaching program that found out they had ADHD because their kids had ADHD. And it's so amazing how when they learn how to work with their ADHD, how it actually helps the relationship they have with their children. Because it starts with, but he's always able to play video games, but he's never able to clean his room. Well, yeah, it increases his dopamine, right?
That's
And
great.
once they understand that, they're able to understand why he can do this and why he can't do this, and then gamify things and help them be able to do what they need to do in a game. Where I had a mom the other day sent me a text. She was like, "Oh my gosh, he loves homework now because we've made it a game, and he's actually we always used to fight during homework." And just understanding that is not a fault. And I was actually going to say what Zach said as my number one challenge, but I'm going to go to another challenge now.
Well, can you hold on to that thought really
Yeah,
quick? Because I want to
yeah,
throw up a
of course.
comment from somebody. So thank you, Mira, for commenting. So she says that my biggest challenge as a parent is knowing what expectations to have. I often wonder if I am pushing enough to allow my son to meet his potential, or am I making too many excuses for behavior or schoolwork as it relates to ADHD? This is such an interesting but on point comment, Mira. Anybody want to comment on this?
I could talk to that.
Yes.
I actually just had a conversation about this with my daughter. I tell her all the time, ADHD is a reason, it's not an excuse. ADHD explains why you're not able to do this and why you're not able to do that. And it gives you the ability to think, how can I do it better? Because I find that sometimes, not everybody, sometimes there are people who do use their ADHD as a crutch. We don't like to talk about this, but it is true. And kids are going to be kids. As a pediatrician, we know it. They're going to try us. Either they have ADHD or they don't have ADHD, they're going to try us. So it's important to also set that limit because, like, she tried it on me the other day. She was like, "Yeah, it was because of my ADHD." I'm like, "No, babes, it wasn't." you know. But at the same time, it's okay to acknowledge, why do you think it was because of your ADHD? Let's have this conversation, right? And then explain to them, actually, this is not because of your ADHD, but what strategies do you want to put in place? Again, giving them the ability to come up with their own management of it. And after talking about it, she's like, "You're right. I just didn't feel like doing it." I'm like, "Thank you for being honest. So but as a parent, I can see how that's hard, right? Okay, is this really ADHD? Is it not? And that's where counseling comes into place. That's where coaching comes into place. That's where family therapy. There's actually family coaching too you can do with you and your child, and they can help you guys dissect which part is ADHD, which part is not.
I feel like Zach wanted to jump in there
Yeah.
and say something.
Well, since I stole what she was going to say, she stole what I was going to say. So I guess we're even now. I always say that ADHD is an explanation, not an excuse. So you kind of have the same thing. And how I expand on that is, an excuse is expecting everyone else to change, and an explanation is expecting me to change. And so, I just follow up on what Dr. Day said, and it's got to be, if your daughter does say it is my ADHD, okay, what is your solution? What are you going to do to help build that skill, rather than just getting stuck in that excuse,
Yes. I love it. Dr. Day, do you feel like you got to answer your challenge there, or were you going to add something else? I want to make sure I give you the floor.
Oh, the second one I was gonna say, the biggest challenge I also see besides that is acceptance. This idea of I have people who come to me and they swear up and down, I really don't think I have ADHD, but I need this. And I go through my coaching with them and they do have ADHD because I've seen enough people with ADHD. And I said, sometimes people are not just ready to accept that they have it, but it doesn't prevent you from getting the help that you need. The question is, are you having these challenges? And if you're having these challenges, it's important to seek help for your children instead of avoiding it. I see it a lot, especially in the minority community, where they don't want to label their children as having ADHD. So they're like, no, he's just being stubborn or he's just being this. And explaining to them, like, okay, call it whatever you want to call it, giving them the ability to call it, give it a name. We all know ADHD is a misnomer, anyways. Call it what you want to call it. The question is he having these challenges and finding the resources? I don't know why I'm saying him or her. If, are they having these challenges and finding the resources that is necessary to help them with it? So acceptance has been a big one that I've been working on, trying to destigmatize that a lot.
Yes. I mean, and again, that's part of having these conversations and making sure that people have access to the right information. Dr. Ramtekar, may I ask you the same question? What is the biggest challenge that you see when it comes to ADHD?
Sure. I feel like I can just hear what everyone's been saying. It's so helpful. I will share my experience from psychiatry lens, because in practice we become really aware of some of these issues, and I totally agree with all the responses so far. From psychiatry practice perspective, there's an expectation of, hey, can we really cure our way out with pills? And I wish we had done a better job as a society to educate that you cannot walk your way out of ADHD with pills, because pills do not have skills in them. So we really need both pills and skills if needed, but we definitely need skills. Having a frank and non-accusatory conversation to explain exactly what ADHD is, to explain what are the current challenges, and then what would be the right management for it, is really something that is very challenging when somebody has already made up their mind that, yeah, we're going to get pills and it's going to fix all of the problem. So I think one of the best ways to manage that is to educate, accept, acknowledge, and then come up with a multi-pronged treatment approach where medications may or may not be part of their solution, but skill building, school support, and family interventions are the core of it.
Yes. Pills do not teach skills. That's just, right?
Love
So,
that.
yeah. But I'm going to just ask you this, Ujjwal, because, I think from the pediatric perspective, I've seen families either say, yes, we need medication, or absolutely not. I do not even want to think about it. We do not want anything to do with it. How do you find the right balance of bringing this up? Because we do know that there is a role for medication as well.
Right. It's a great question. And it happens two ways. One, parents saying, I'm afraid of medicating my child. I don't want to do that. Or a child saying, yes, I have ADHD, but I do not want to take medications. I think it's important for us to get to the core of why they're afraid. So, for example, in case of parents, there's a huge misconception that because these are stimulants, that somehow they're going to have addiction potential and my child is going to have substance use issues, or it's going to change their brain somehow, or that they will not be normal, or that they're somehow changing the trajectory and the development of their child. And we need to educate. Actually, untreated ADHD equals untreated adult, who's going to have work problems, life issues, relationship difficulties, and just overall quality of life. And so appropriate treatment and early intervention is something that's going to prevent the lifelong difficulties and in sometimes misery, is the key message that we want to give to parents. When it comes to children, you again have to go to, why are you refusing to take the medication? Which is where, again, having a frank and non-accusatory conversation about understanding their reasons is very helpful. Many times they know they want to take medication, they know it helps, but it makes them feel different, because who likes to be called out in the middle of their class to go to the school nurse and take the medication? That makes them feel different. And we can accommodate and say, do it during lunchtime or do it in between classes. Or it might make them feel that somehow they're different than others. And at the core is some self-esteem difficulties. And if we could address the self-esteem first, then they're much more open to accept these treatments as well. So again, we take multiple approaches depending on what exactly is going on, because ultimately, when you see one child and one parent with ADHD, you see one child and one parent with ADHD. Everybody has a different reason, different presentation, different expectations, and different response. And we need to customize it and calibrate it based on what are their needs and meet where they are.
Absolutely. Thank you so much for that wonderful response. Thank you. Dr. Diana, what is your biggest challenge that you see when it comes to ADHD?
Well, I think I have a unique perspective because I have 40 years of experience with ADHD myself, right? And I'm a physician, I'm a family physician. So I actually do treat patients who have ADHD. And then I'm also a coach, an ADHD life coach for physicians and for healthcare professionals. So I get to see it from all kinds of perspectives. And so, of course, they even the physicians tell me I don't want to take medications because it's going to come out in my drug screen and they're going to think I'm like, you know, doing something and I might lose my job. And I'm like, but it's a prescribed substance. Like you need it. Like wouldn't a diabetic take their meds? Like why would you not take your meds, right? And so why am I saying this? Because people don't realize that if you don't take meds, and 80% of people will use the medications and they will work amazing for them. Of course, there's some nagging side effects that could happen, but they're not life threatening. And so you get to decide the risks and benefits with your own provider, whether this is something that might be useful for you. But within 30 minutes of you taking a stimulant, you can start to have 25 tabs open. Now you go down to 5, right? It doesn't mean that now you have all the answers, but at least you have the pause that we don't have. We don't have that 2-second delay if you're not taking the medications. And that 2-second delay could mean life and death in a car accident, right? And so, why am I saying this? Because people who don't take medications as adults, you know, and even kids, like they have injuries. There's a lot more injuries in the ER with broken bones, with concussions, with different things like that, right? And so it decreases their lifespan 15 to 20 years, okay, compared to somebody who's going to die from smoking and heart disease. So this is a serious thing that you can't just ignore because again, choosing not to take your meds does not just affect you, it affects everybody around you, how you interact with your coworkers, how you interact with your kids, how you interact with your neighbor, road rage, everything, right? So again, the more you understand, the challenge is that it's like an invisible thing, right? Like you can't see how hard I'm working or how many things, how many hours it has taken me to try to do this task because I got sidetracked somewhere because something was exciting, right? Or and so you can't see how hard I've been working. You don't see a broken bone. You must think, oh, it's fine. She didn't work that hard. She got the task accomplished. What's the problem? Right? But that's the thing that you need to realize that you don't have to work 10 times as hard if you take the meds and if you get somebody, a therapist, a coach to show you the skills that we were just talking about.
Mm-hmm. Yes, thank you for sharing that perspective. I think, especially for professionals who have ADHD, I know there's a lot of stigma around that too, and disclosing that and that shame. So I'm really glad that we're having this discussion, so that way we can just destigmatize ADHD in general, right?
Can I add a little bit to that?
Yes, please.
So, as a physician and coach, I see people who come to me specifically because I'm coming to a coach because I do not want to take medicine.
Mm-hmm.
And I see them struggle and struggle and struggle. And I believe in a holistic approach. I talk about skills and pills come together. A lot of times, people are trying to build structure on a quicksand. It's real. Yeah, maybe you could make it work, but it's really difficult. And sometimes I've been able to convince people, if it's not for any extreme reasons why they don't want to take it, is why don't we at least take it for this time to build our structure? And then once we have our structure built, then maybe you can try to win yourself off it and see if that would work. If you're somebody out there, because I've had some people say, my doctors have been pushing my medicine on me. The reason why we talk medicine is because we know it helps. But we also know it's not just pills, and it's just not skills sometimes. It's the pills and the skills. So if you're that person out there that you're worried about your child not doing well and you're really, really anti-medicine, maybe consider it that way. Like, let's just do it to get our skills up and see what we can at least accomplish in that meantime.
Mm-hmm. Yes, thank you for that. Thank you. Lafayette.
Yeah.
From your perspective, what is the biggest challenge that you see when it comes to ADHD?
Okay, well, first I have to say happy birthday, Dr. Nerissa.
Oh,
I did not know your birthday was on Sunday, so happy birthday.
Thank you.
And I mean, I've been sitting here thinking about this, and I'm like, oh my goodness, should I talk about executive functioning issues or should I get into sensitivities, because they're both so humongous, right? So I think I'll pick sensitivities, which, that comes to on a wide spectrum, right? So we have our rejection sensitivity dysphoria, which impacts just like every way that you perceive things and the way that you interact with others and the level of emotion behind what it is they're saying and, how you're taking it and all of that. And then also, to even talk about the sensitivities, the sensory issues that people often miss for those who, those with ADHD. They'll go unacknowledged. So, the kid or even the parent may be bothered by certain things, going on around them, and nobody is really identifying that sensory issues can be a part of the problem. So it may cause an emotional dysregulation in you to really be, to be hit with something that really bothers you, from that perspective. Mm-hmm. And so, and then Dr. Nerissa, my emotion soaking piece, that's my big time piece, that, unintentional sponging of the feeling energies of others. Those with ADHD tend to be very, what people call intuitive or very in tune. And so oftentimes you'll meet those who don't feel to you to be an empath because they do not want to fix anyone's issues, but they are strongly drawing from the emotional, reaction, the internal reactions of others, but nobody can put a name to it, right? So I think not enough education out there about the sensitivities and how sensory issues play a part and how they can, set someone up, our kids up, the adults up, to already get to that, that 0 to 60 or that, 0 to 100 so much more quickly. And that, leads to that misunderstanding that Lisa spoke to earlier. So there are so many pieces. Like,
I mean, I know, but I was hoping you were going to bring up emotion soaking, because I think, that oftentimes is one of the biggest challenges that I see in my practice with the, the relationships, the stress and the strain, the emotion dysregulation, and just how to help teach parents and kids to co-regulate together. That is so hard. It is so hard. But it's so necessary, right?
Oh, it's hard and it's easy at the same time.
I know. You got to work with someone like you, Lafayette. So, All right. So I'm going to kind of switch it up because I'm watching the time, but there's so much to talk about. So I have a list of things that I thought either from parents who've submitted before or just questions that I know come up routinely. So I'm going to just kind of throw out a word, and then somebody raises their hand and just, gives a response. Okay. I wish I had like those buttons or something that you can just like, it's me. So I'm going to throw out the word homework in relation to ADHD. Anybody want to comment on homework, please? Yes, Lisa, first.
If they're not taught how to self-regulate in school, it's absolute torture at home.
Yes. So let's talk about that really quick, because I have lots of parents who are like, oh my gosh, if I have to sit down and figure out math and how to teach it in this way, and it's taking us hours, and then it's time to go to bed. What words of advice do you have? for these parents? How do we handle that? Yes.
You have to gamify it. That works for me. Like, you have to make homework not work. Change the name. Do whatever it is to make it fun. Make it enjoyable. We know what helps kids with ADHD, right? And the higher they go up, the harder homework gets. So the earlier you start seeing homework as something that is not a challenge to see how smart they are, but a fun way to show mommy this. Or like if they have a spelling test, let's see how fast we can do it. If we have let's say like actually making an enjoyable time. There's sometimes I see parents and this is not against, but I get it, where it's like a fight to do homework. They have anxiety trying to do homework. And kids can feed off that too, right? But if you're like, come on, guys, let's do it. Okay, we have an hour. Time it down. We do Pomodoro in our house because we're all ADHD folks. So we have Pomodoro going 25 minutes. Let's see how much we're doing 25 minutes. You go, you go. I have 3 kids all in school. So like this is how we do in our house. The 5th grader is going, the 2nd grader is going, the baby is going. We're all like doing what we have to do. And we have like little who did this for us, and it's a fun challenge, not a challenge of, oh, you missed it, right? And it's been helpful because the kids love homework time because it's fun time. So that trick has worked for us. It doesn't mean it'll work for you. But one thing I realized is you got to make them love it, because we all know ADHD gravitates towards fun.
Mm-hmm.
Any kind of negativity, thanks.
Yeah.
It just doesn't work.
Yeah.
Okay. Gosh, so many hands. Okay, so let's do Lafayette, Diana, then Lisa.
Now, I agree with you. It's good energy, right? First and foremost, because we want them soaking up the good energy, right? Validation, and don't be afraid of accommodation. So those are my key word: validation and accommodation. So it is a very valid situation. Even if you have a highly intelligent child, it is valid when they have a hard time starting certain projects, when they, it takes them a little bit longer. All these different things can be at play. If this is distracting, that's distracting. You don't have a nice space for them. And by the way, please find a set space for them to do their homework that has no distractions around it. Just a little side note. But then also when there continues to be struggles, and it seems like the child is understanding the homework, then don't be afraid to ask for the accommodations you need. Because oftentimes what you'll get from the schools is a denial of the accommodations because the intellect is there, and they don't take into consideration the challenge level, and that is taking hours. The other kids are getting it done in 30 minutes, not because they're more intelligent, but because they're able to start a project faster than your child. So don't be afraid to ask for accommodations, and I'm going to shut up.
Thank you. Okay, Lisa.
So there's 2 things real quick. So one is the executive functioning. If you have a child and you know your child has ADHD and your child is having a difficult time at home, understand that their executive functioning may be depleted. They may have worked and really exhausted themselves with their effort during the school day. So having a communication that's open and real with the teacher, I think is really important. But on the other side, to support, and by the way, Dr. Day, I'm coming over your house and I'm going to give myself homework because that sounds like a whole lot of fun. So I love her approach. And yes, it's really important that we meet the child's needs in their approach so they are initially engaged in what I call launching. So the clients and the students who I work with, it's all about making visuals. And so those visuals are supported with action skills, even perception, positive self-talk, to launch cognitive engagement, right? Having those skills in front of you is so important to raise their awareness of what they need. So when they're doing their homework, to avoid that frustration or, and avoiding that feeling overly emotional and sensitive, I can't do it, which is a big feeling often that they have, and it's constantly reinforced, and we don't even realize as adults we're doing it because they're also doing it by comparing themselves to others. So what we need to do is really teach them to become aware of how they're feeling, be able to breathe for that calm mind and calm body. So that way they can think, okay, wait, I need my math tool because it has strategies on it. And I'm forgetting. I could draw a quick picture, use manipulatives. And I'm not really focused. Let me take my focus tool out. Once they can establish that with a parent or teacher's support, now we're talking about prolonged perseverance and continued learning while Dr. Day still having some fun.
Yes. And I know, gosh, we have so many words here, but I think, Diana, did you have something to add about homework? Oh, you're muted still.
I was just gonna say, like, creating the environment for it, like Lafayette was saying, because if you know that that's the clean area in the living room where we're gonna do it, then you know where we're gonna do it. Instead of like pretending like, oh, well, there's too much clutter and I can't even focus because they're playing with the paintbrush over there and doing all this other stuff, and then maybe what gets me in the mood is music. So like turning on some music that's high energy, because like we said, at the end of the day, your EF is gone. Even if you want to, like, it's gone. So using some tricks and using a timer, because with the timer you're like, okay, well, we're not gonna have to do this for 5 minutes, and then we're gonna get to dance, and then we're gonna do this, and then in dancing and jumping, like, you're increasing their dopamine, so they're more like, and they're having fun. And so homework doesn't have to be this rigid thing. And of course, I know that I understand that the reason I could study in medical school was because I was walking around the track for 3 miles and listening to podcasts, right, about the lectures. Why? Because if I sat in that environment, I would have been like talking to everybody else, because that's more fun. But this way, as you're walking, so not constraining the kid to sit down. That's what I'm trying to get at. Like,
Yes.
what if maybe they walk around and they tell you the stories, or they tell you the words or whatever that might increase their dopamine as they're doing that, especially at the end of the day when it's EF is gone.
Yes. Thank you so much. Okay. I'm going to just have to say 2 more words just because of the time, because I don't want to keep us too late. But how about sleep? Somebody want to comment on ADHD and sleep? Oh my goodness. I know somebody's got it.
I don't.
It's
I don't.
necessary.
Zach.
Just dysregulated. So many times I have clients here, children, that too much, too little. It's hard to get started. Really got to have as much of a routine as possible. Even, for middle school and teenagers that I talk to, I'm trying to avoid those things that are super stimulating 30 minutes before bedtime, because once they get in that hyper focus and their brain is going down that one-way track, it's hard for them us to relax.
Mm-hmm.
So yeah, dysregulation comes with it, with that
Yep.
ADHD.
Yep. Dr. Schechter, and then Ujwal. Yep.
Yeah, I was going to add that I feel like I hear a lot from parents about this dysregulation in sleep, and I feel like I hear so often, like, this is how they've always been. They've always been really, really not great sleepers, and I think kind of tying this together with what was said earlier about homework, of just the importance of the environment and how much the ADHD brain is impacted by the environment, and kind of just keeping that in your awareness as a parent of how do you create this environment that's going to elicit certain behavior. So if you're doing homework, okay, let's do it at this place. We're going to do it maybe in this room every time. You can walk around, but let's keep it as kind of, this is the environment we do homework in. And for sleep, how do we keep that as calm as possible? Try to keep, if homework is, keeping schoolwork maybe out of the bedroom, so that really is a place that they can really relax and kind of get those cues from the environment.
Yes, love that. Dr. Ramtekar.
Yeah, again, I'm going to take a little bit of medical perspective.
Yes.
The children with ADHD and adults with ADHD also have very common co-occurring sleep disorders. Some of the common ones are what we call as periodic limb movement disorder, where they're moving a lot in their sleep. And imagine that. When we sleep, your brain is going through a reboot. It shuts down and then wakes up. If you're moving all the time, it's only going to the screensaver mode and never shutting off. So there's no reboot. So all the benefits of reboots are not there. And the ADHD appears to be worse the next day. And the medications don't work. They're more sensitive and sensory reactive. they're more hyperactive, there's focus and concentration issues, and eventually it leads to crashing and irritability. When those kind of things happen, we want to probably take a step back and say, sure, they're sleeping through the night and they're not bothering anybody, but when they wake up, are they nicely tucked in? Is their bed looking okay? Or does it feel like they were just dancing in their bed all night long, and are all the sheets all over the place? If that's the case, get them checked out, because they might be struggling with some low iron, a specific type of iron called ferritin, which could easily be replenished by doing a little bit of dietary change, or maybe taking a little bit of over-the-counter iron supplement for 3 to 6 months. And that might avoid a lot of uncontrolled ADHD-like symptoms during the day that probably is coming generally from sleep as well.
Yes, thank you for saying that. I think sleep is a biologic need, and when we talk about not just the quantity but the quality, it's so important. And I know a lot of general pediatricians like to start there too and make sure we're getting good sleep, because if we don't get good sleep, it affects everything else: concentration, focus, mood, behavior. So thank you for that. Yes, thank you. We have here. Hi, Dr. Clark. Thank you. Great advice, she says. So let's throw out another word here. Negative thoughts. Negative thoughts. Touched on this a little bit. Anybody want to tackle that one?
Okay, I have to say affirmations.
Okay.
So because what I tend to teach is that the mind is constantly going, moving, right, and whatever is going into your ear hole most of the time is, or oftentimes you'll hear a lot of negative things coming at you, especially when you're living with ADHD and people don't quite understand you. And so really being able to record over those negative recordings, right? I always say thoughts are they're only words in our head. This is just putting new words in our heads, so that we have a new track of thought to have. So I love to, for both, actually for sleep as well. I love to mention maybe trying to use meditation affirmations in order to kind of get yourself into a better pattern if your organic brain is not going to do it for you. So.
I think negative thought for kids is actually very important to teach them what thoughts are and what emotions are. Is the first step, because a lot of times they don't even really realize what that is. So having them again go to someone who can explain those kind of thoughts. I remember an amazing, wonderful program me and my daughter took with with Dr. Bauer, and she talked about the different emotions, and she talked about ants in my brain, and now my daughter uses that a lot. Actually, it's been very helpful. So putting a shout out for Dr. Bauer's ADHD class for children. And it's been really good. So actually teaching them, because I used to say, oh, stop being negative, stop being, I don't think she really understood it. Because again, children don't understand what we mean by emotions and what we mean by thoughts. With ADHD, our default, unfortunately, is negative. We don't really think about all the good things we've done. We talk about, oh, I'm always late. But you are a pediatric cardiologist, right? We don't focus on the achievements. We always default to the negative. And I see this a lot in the little kids as well, and showing them that the emotions you say goes to your feelings, and your feelings then becomes who you are. And that rewiring is very, very important with the ADHD kid. And whenever they get a negative thought, counteracting it immediately is always very helpful.
Thank you so much for that. Dr. Schechter, Lisa, then Zach.
I was just going to quickly add and maybe just extend what Dr. Day is saying of just up to parents. I feel like I often talk to parents too, are having negative thoughts either about themselves as parents or about themselves as ADHD adults, and taking that time to, to kind of pull apart the thought and the emotion and how that affects their ability to parent. And so kind of just helping them sort of see, okay, what is a more balanced thought here, and how does that affect your emotions? And then how does that affect your ability to really, give your child with ADHD what they need?
And to be able to know what they need, we need to ask them. So with that, for instance, that's Henry. Henry has ADHD, and the book Henry's Thoughts is an author visit that I have, that I go into classrooms to teach specifically and explicitly positive self-talk. And one of the questions that I ask is, well, we go focus. So everybody say focus. So we say focus, and then we all whisper it, and then they say it, in their head. And then I'll say, did you hear it? And some of them are like, oh my goodness, I did or I didn't. A lot of kids don't even realize that they have a voice, or they don't hear it because they're busy seeing things. And so with that, I think really differentiating and having them learn it explicitly can help in so many areas.
Thank you.
Yep.
Zach.
Oh, just and really quickly, our brains seek stimulation, and really negative thoughts about yourself or the world can be very stimulating. We can, it's not good for us, but it can kind of feed that need we have in our brain. And so as much as you can as parents, just try to depersonalize any complaint or redirection that you have. Try to focus on behaviors and not the person, not the child, not the you always, why do you never, why don't this, just I need this. Be very authoritative with your parenting directions, and making sure that we're not losing control of our own emotions, but also displaying any kind of distorted thinking towards them, and kind of like Dr. Schechter mentioned as well.
Mm-hmm. Yeah. Anybody else want to add to that before we go to our last question? Yes, Dr. Ramtekar.
I'll just say, for both kids and parents, stay in your middle lane. What I mean by that is, don't give in to the thoughts that are always extreme. I will never be able to do this well. I always mess up. I'm never going to be a good student. You are so lazy, you'll never be a good student. Why do you always have your room so messy? We need to stay in the middle lane and not shoot ourselves, and not have all the extreme lanes, either left or right, extremely positive or extremely negative. And as Zach has said, depersonalize. It's not you, it's your ADHD, and you're wired to focus more on negativity. It's very important that we learn, as we are trying to take control and be on the driver's seat, that we recognize that our ADHD is always going to be there. We're not able to kick them out of our car, but we need to replace them from the driver's seat and put them in the back of the car. So they are there. We're not getting rid of them. We're just learning how to manage them as well.
Yes. Oh my gosh. There's so many like little nuggets in this. And I can't wait to have this like replay and kind of re-listen to that, because there's so much here. So I know that we're kind of at time, but I do want to end with asking everybody, what is the one thing you wish parents or kids knew about ADHD? And I think we're going to go ahead, and now I'm going to start with Lafayette, go the other way. You ready, Lafayette?
Yes.
Okay, let's do it.
One thing that I wish that kids knew was that there's absolutely nothing wrong with the diagnoses, right? And I guess I would say that the same for the parents, but the other thing that I wish that parents just automatically knew was that they get a lot further through understanding than they do by understanding than they do by not understanding. So if you can work towards, every time you think, I don't know why, or I don't understand, moving towards, okay, so let's figure out why, or let's figure out how, even better. Let's figure out how to create a solution for this, then things would go so much better for you in your relationship with your child.
Mm-hmm. Yes, thank you so much. And again, for all my guests, we'll be adding in websites, other ways to contact them. So hopefully we can keep this conversation going. Thank you for that, Lafayette. Dr. Diana.
So the question is takeaway, right?
Yes. Like, what is the one thing, I guess, either that you didn't get to speak of, but one thing you wish parents or kids knew about ADHD?
That this is a lifelong condition, that it's neurological, that it's genetic, and that, just like I heard Dr. Ramsey say, ADHD is the diabetes. It's a psychiatric diabetes, meaning it can be treated there's lots of modalities for it, but it's lifelong, and therefore you do need to set all those structures in place. And so, like we've been saying, it starts and ends with you. So own the diagnosis, embrace it, and use it as a superpower. It's a gift. You just have to learn how to unwrap it.
Yes, thank you for that. Dr. Ramtakar, I'm going to go to you.
Well, the word I would say is acceptance, because ADHD is, even though it is a neurological brain disorder, once we understand the superpowers it has in it, we are going to live our lives to the fullest. We are the most fun, most high energy, most intuitive, extremely positive, really funny, and very creative people. And guess what? We need more positive, resilient, and happy people in the world right now. So go capture your superpower and make the world happy.
Yes, I love it. Oh, okay, Dr. Lola Day.
I didn't realize I was on mute. And I'm gonna go on and segue with what he said. I feel like every mom or parent and child should know that with positivity and staying in our positive and ADHD will actually help you thrive. ADHD thrives when we're in a good mood, when we're happy, when we think good of ourselves. Any of those things will help us. And if you ever wondered, am I going to be this person or that person? I have ADHD. Use anybody in the world as an example. There are business people, there are physicians here who have ADHD, and lawyers here who have ADHD. So you can do it.
Yes, thank you. Thank you for that. I love these messages of positivity and hope, right? Zach.
Well, for parents, just don't beat yourself up because there's not immediate behavioral changes. Uh, because of the executive functioning issues, memory, impulse control. It takes a little bit more time for us to see those changes. And so, because of that, so many times parents may go down on themselves, get angry, get anxious. Don't beat yourself up. Just remember that you're planting seeds that will grow later. And so think of those seeds as the executive functioning skills needed, the environmental changes needed, and things like that.
Yes, so well said. And please tell people about your book, your title.
Scattered to Focused. It's developing executive functioning skills for children 8 to 12.
Yes, and I highly recommend it. So thank you so much for being here tonight, Zach. Dr. Schechter.
Yeah, these are all so great. What I would want people to know is that this is real. I mean, I was really struck by, Dr. Diana, what she mentioned about, people die younger. I mean, this is a real thing. And it is a disorder of performance and being able to perform consistently, but, it's not a disorder of what someone is capable of, right? Like, we know that people with ADHD can be so incredibly capable and successful when they have the tools that they need. And so, I think what I would tell parents is, to advocate and to get the tools that their kids need.
Yes. And, it's, trying to get that education, surrounding yourself with the team. And it does really take a village, right?
Yeah.
So, yeah. Thank you again for being here tonight, Dr. Schechter. Lisa.
My last words would really be to become educated. Make sure your child becomes educated about what works and what doesn't work for that particular child. And then support your child with learning the cognitive skills in how to learn. It's not about what to learn, it's about how to learn. And at the end of the day, always tell your child that they did their best, they used what they knew, they tried to use their strategies, and to always believe in themselves and don't worry about what anybody else is doing.
Oh, yes. And to wrap it all up, I think the biggest thing is is that, I'm so glad that we're spending this time tonight shedding light on what ADHD is, and that it is a brain-based neurologic condition. It's not a death sentence. There's so many people who have ADHD and are thriving. We just have to help our kids and the people around them to understand how to work with our beautiful brains, right? And I also believe that all kids, even the 3-4-year-olds, we can start framing that discussion in a very positive way. My favorite way is like taking on the detective role. So like looking for clues. How are our brains working? What do we need to still do, right? And just be inquisitive about it. Like if you come up against a speed bump, like, oh, what happened there? What do you think we could have done better? We've got to kind of figure this out. I know we can figure out a different way to do it, right? So again, just thinking about that, reframing it, but come together, having those conversations as a family, working with your team, and just, remember there's so much out there in our toolboxes. We just got to, build it all up and work together. So I hope everybody found this helpful tonight. Thank you to all my guests. And I see Giovanni, I know you asked what's the one thing you advise parents to do to help with ADHD behaviors. I hope that in my questioning here that we answered that for you tonight. And then also thank you, Wendy, for joining in. This was so helpful. Thank you so much. Mira, again, agree. Thank you. So again, all of you have a good night. And if you want to, please share this broadcast. It's immediately available once we end it. So for those who didn't get to come on and join us live and ask questions, you can always watch the replay and then reach out to all my guests. And I'll be sharing all their contact information in the coming weeks. Thank you so much. Thanks for joining the movement. And let's make sure that everybody knows that ADHD and having ADHD is a superpower. Thanks again. Bye-bye.